nucleoside phosphorylase deficiency, often called PNP deficiency, is a rare autosomal recessive metabolic disorder which results in severe combined immunodeficiency or SCID. People with SCID lack virtually all immune protection from foreign invaders such as bacteria, viruses, and fungi. Affected individuals are prone to repeated and persistent infections that can be very serious or life-threatening. Purine nucleoside phosphorylase deficiency happens when there are mutations in the PNP gene. The PNP gene provides instructions for making an enzyme called purine nucleoside phosphorylase. This enzyme is found throughout the body but is most active in specialized white blood cells called lymphocytes.
Purine nucleoside phosphorylase is known as a housekeeping enzyme because it clears away waste molecules that are generated when DNA is broken down. Mutation in the PNP gene reduce or eliminate the activity of purine nucleoside phosphorylase. The resulting excess of waste molecules and further reaction involving them lead to the buildup of a substance called TGTP to the levels that are toxic to the lymphocytes. Immature lymphocytes in the thymus are particularly vulnerable to a toxic buildup of TGTP, which damages them and triggers their self-destruction. The number of lymphocytes in other lymphoid tissues is also greatly reduced, resulting in the immune deficiency characteristic of purine nucleoside phosphorylase deficiency. PNP gene is inherited in an autosomal recessive manner. This means that the defective gene responsible for the disorder is located on an autosome, and two copies of the defective gene, one inherited from each parent, are required in order to be born with the disorder. The parents of an individual with an autosome recessive disorder both carry one copy of the defective gene, but usually do not experience any signs and symptoms of the disorder.
In addition to the symptoms associated with immunodeficiency, such as depletion of T cells, decline of lymphocyte activity, and an abrupt proliferation of both benign and opportunistic infections, people with purine nucleoside phosphorylase deficiency are also at increased risk of developing autoimmune disorders, which occur when the immune system malfunctions and attacks the body's tissues and organs. Lupus erythematosus, autoimmune hemolytic anemia, developmental delay, intellectual disability, difficulties with balance and coordination and muscle stiffness, developmental decline, hypotonia, mental retardation, and idiopathic thrombocytopenic purpura have been reported with PNP deficiency.
The disease was first described in 1975 in a patient who had absent T cell function but intact B cell immunity. The immunodeficiency was progressive with normal immune functions at birth, but severe T cell deficiency with intact B cells exhibited by the age of 2 years. A complete absence of PNP was noted in red blood cells, white blood cells, and fibroblasts. It was subsequently reported that the parents of this patient had approximately one-half of the normal level of PNP, indicating an autosomal recessive inheritance. Stephenson and Tomey of 1990 stated that the family reported by Graham Pohl et al. Of 1975 as having familial disequilibrium dysplasia with T lymphocyte deficiency turned out to have PNP deficiency. The condition was diagnosed retrospectively from stored fibroblasts from an affected child and from demonstration that both parents have half normal activity of PNP.